And so while we're waiting for additional responses to these polling questions, I'm going to take this opportunity to introduce our discussion starters. And at this point, I'd like to invite our discussion starters, Alicia, Paul, and Ole. I'm so sorry. Ole to turn on their cameras and introduce, and just for brief introductions. Alicia, if you'd just like to just take a moment to introduce yourself just very briefly.
Hi, I'm Alicia Roast from Minnesota, and I am a lifer with vitiligo at 43 years.
Thank you. Ule?
Yes. Hello, my name is Ulla. I'm 18 years old, and I'm from Sweden, actually. So, and I have had vitiligo for as long as I remember.
Thank you. And Paul? Paul, you're muted. There we go.
Hello, I'm Paul Montero. I'm from Holland, from the Netherlands, and I am chair of the Dutch Vitiligo organization. I am also a board member of the FIPOC, the Vitiligo International Patient Organization Committee. And I have vitiligo from my, as a youngster of 12 years, but when I became elder in 2008 until 2012, I became totally white. So I transformed from a man from Indonesian, with Indonesian roots to a total white man. I have vitiligo universalis.
Thank you so much. So looking back, I really appreciate you joining us, and I'd also like to invite our panelists from session one to be ready to kind of turn on your cameras to participate as discussions permits. But I will say that it sounds like we have a good number of callers on the line, so we will be turning to those callers as well. So to start out, it looks like there are a number of ways, looking back at the polling questions, that vitiligo impacts people's lives. And so maybe I can start here with Alicia. Maybe if you want to tell us a little bit more about how vitiligo has impacted your life, Alicia.
Thank you. As I said, I am a lifer with vitiligo, so I've gone through the childhood all the way to adulthood with vitiligo. And as a child, it was very difficult, especially being from a small town with no one else with vitiligo, having anyone to turn to. It was very isolating and hard. Bullying was definitely a factor. I was called Spot. That was kind of my nickname for people, unfortunately. And it definitely was a hard thing to grow up with. Being an adult with it, I've lost I'm probably about 85% depigmented. And so now dealing with vitiligo as an adult is more of the limitations of being able to be outside, going to the beach without wearing head to toe UV clothing or sunscreen. Baseball games for my son is difficult. So it's the hard part of dealing with it, growing up with the psychological issues, developing who I was because of that, and now being an adult and dealing with just the day-to-day life with vitiligo, and also having other autoimmune diseases too, besides vitiligo. So that's kind of my background with having to deal with vitiligo in my life.
Great. Thank you. Well, not great, but thank you so much for sharing your experience. That's very helpful for us to hear. Before I turn to our other discussion starters or panelists, I think we have someone on the line. Do we have Cindy on the line? Can we put Cindy on? Cindy?
Yes.
Hi, this is Robin. You're on the line to talk about your experiences with vitiligo. If you want to share one or two things, a minute or two, we'd really appreciate it.
Yes, ma'am. I developed vitiligo when I was 20 years old. Up until that point, I had done local modeling and that kind of stuff, and my disease started on my face. So you can imagine the psychological side of that I went from being somebody that was photographed and out in front of people to having the changes of skin color. And it provided a lot of depression and psychological issues to the point where I wouldn't want to participate or go out, and limited my involvement in things. And then I met a man, and I got married, and he had no issues with that, and we have children. The main part of that is I'm a third generation person with vitiligo, and while my home was very supportive, I want something to happen in some sort of development that my children won't have to go through the name calling and the mean things that people say and the hurtful things and the staring and all of that. And while I tried to be supportive and strong for my kids to make it fun, when my daughter was little, I used to let her play connect the dots on my leg just to have some fun with it. And she used to love that. She thought it was cool. But I'd like to see something that this is a generation that we turn it around and change that, help to educate society on it, and give a little more empowerment to those of us who are dealing with the loss of pigment, that we can feel more comfortable and not feel like outcasts and be stuck in our homes and that kind of thing.
Thank you. That, I think that's a point that we've heard raised by several people today, and it's certainly very important. Thank you so much. Let me now go to I think we have one more caller on the line right now, Rochelle. Maybe we can put Rochelle through, and then we'll turn back to our panelists to see if they have anything to add. Rochelle, are you on the line? Okay. I don't hear Rochelle. So let me then turn back to our panelists, and actually let me ask Dr. Marcus. I think she has a question that a clarifying question that she would like to ask. So let me go ahead, Dr. Marcus.
Thank you. Thanks, Robin. And thanks to everybody who's shared so far. It's really been helpful to hear about all of the challenges that people go through. There are physical challenges, psychological challenges, and even career challenges, as we've heard from some people. We've also heard from people that the challenges bring about a good deal of strength and resilience, although everybody has a very unique path, it sounds like, in terms of when and how they get to that point of acceptance of strength and resilience. And I've also heard that it's very difficult, particularly for children, and experiencing bullying and isolation. And so my question is, when would people consider taking a treatment that may be very effective, but may also have some significant, potentially significant side effects associated with it? From listening to everybody today, from my perspective as a regulator, I'm trying to understand when people would consider taking a treatment because of the impacts that it's having on their lives versus trying to push through and come to a place of acceptance.
Great. And so let me see. I don't know if there's anyone who'd specifically like to speak to that. Ulla, did you want to speak to that, or maybe would you be interested in speaking to that, or maybe we should turn to Paul? Do you have a preference?
Yes.
Okay.
Sorry.
Go ahead, Paul.
Before I was retired, I was an entrepreneur in healthcare, a successful entrepreneur in healthcare. And in fact, I was bothered about the fact that people, when I was doing a discussion with my clients in the hospital, they're looking at my hands and not looking what what I was to explain to just. So my communication was just focused on my hands and not on what I was telling, in fact, and that was bothering me. And at that point, at that moment, I started to try some therapy, UVB, etc. But the most important thing I think when I lost my color was that I transformed you. I told you in a period of 4 years into a white person. But I've lost also my genetic properties. I was proud of my color, proud of my Indonesian color, and I changed from skin type 5 into skin type 1. So I told you I was so proud of my Indonesian roots, of my Indonesian skin, and I was successful. And I'm proud that a man with Indonesian roots could be a successful businessman. In fact, in Holland, you know that Holland, Indonesia was a colony of Holland. So that's the reason I was proud that I became a successful businessman. And because of the vitiligo, I was proud. I was worried that I wasn't. How can I explain you that?
Right.
I was proud to be a successful businessman.
Right. No, so it sounds like kind of that loss of identity, loss of
yes.
kind of cultural identity has been something that has really impacted a lot of our panelists. Let me turn. I think Mark, you had your hand raised. Did you want to speak to Dr. Marcus's question?
I do, and I don't want to speak on behalf of everyone with vitiligo, but I run a podcast and I talk to many individuals with vitiligo. And when it comes to treatment, it works for some and it doesn't work for others. And I think that's the challenge that we have when we look at getting a treatment. How successful will it be to cure my vitiligo? I did the cream. The cream did nothing for me, so I stopped. I know some people that have tried the UV treatment, it did not work for them and they stopped. So I think when we're looking at treatment, we want something that's going to work for, I guess, the majority of the population and not just for some, and with minimum side effects, because I think that's what scares a lot of people. The side effects could be worse than the actual treatment. So I feel like that's one of the concerns I hear, and hearing some of the stories for people that have tried various things. Thank you.
Thank you. So, Ulla, did you want to add anything here?
About the treatment.
And just about your experiences. I know that you're one of our younger panelists for this round.
Yes. Yeah, just a quick summary. Well, I've kind of in a way been pretty lucky from a young age because, as I said, I have had vitiligo since I can remember. So, but in the early stages, I only had one spot on my knee, one on my foot, and just behind the eyelashes, and so it covered itself really. But then out of nowhere, when I was 15, it just exploded. All over my hands, down on my face, all over my arms. So I feel that kind of shock still to this day is, now it's been 3 or 4 years since all of that came, but I'm still pretty shocked because it happened so quickly. And I think that's just crazy how it changes so quickly. And but that said, I was pretty lucky in the younger stage because I never got really bullied for it because people didn't really see it. Nowadays, of course I cover myself up every time I don't go out. But when I was younger, I don't have really much to say from the stages when I was younger because I was pretty lucky now.
Great. Thank you for sharing that. And I think that's one thing that I heard while kind of talking to our panelists, and I think something that we'll hear maybe a little bit more as we continue our conversation is this kind of the challenge of never knowing what to expect and not knowing if your vitiligo is going to change over time and the impact maybe that has. Let me take a moment now. We do have a number of people on the line, so let me see if we've been able to get Rochelle on the line. Do we have Rochelle on the line? Hello?
Just
Hello?
a little jelly. I don't like a lot of jelly. And
Hello? Can you hear us? Hello?
Hello?
Yes, hi. Is this Rochelle? Hello?
Hello? This is Lavise Brinkman.
Okay. Were you interested in sharing your experiences with vitiligo?
Oh, sure. I'm sorry. I wasn't prepared. Sure. Actually, I don't have vitiligo. My son has it. He was diagnosed at age 12. And it came from being bullied at school. And that summer it appeared on his skin. I actually didn't even know what it was. My daughter was getting ready to be a flower girl at my niece's wedding. We were trying on shoes, and I looked down on his knees, and there's these spots. My brother-in-law is a physician, and so when we went to Philadelphia, I asked him, what are these spots on Derek's legs? And he said that it was vitiligo, and I need to get it checked out, and sure enough, it was. It started in his legs, and now he is 18, his first year of college. It's on his face. His legs is mostly white. His feet is mostly white. For him, he's adjusted very well. The first thing that I did was to get him around other children that had it. And so I was part of a group called AVRS, which was very helpful for him because he was able to talk and share, and they were able to communicate and share their stories. And then I got around adults that had it, very positive, like Andre, who's on the panel. Just being around adults and how they adjusted well has helped him at this point. It was very scary to see him go to college, to be honest, because when we changed schools from the one where he was bullied at to another one, his vitiligo had just started, and so it grew with him, so he didn't experience bullying. Going off to college in a different state, in a different environment for people who did not know him was very scary for me. He just went with the punches. He has adjusted very well. I have not heard anything about being bullied. He fits in with just everyone else. And so I think that is one of the great things for him. I do know that when he is in the sun, his skin turns very red. But he's a boy. I cannot convince this boy to put on some suntan lotion to save his life. But he doesn't complain. I just know that his skin gets really, really red in the sun. But as far as his attitude at this point, he's adjusted very well. And I think it just has a lot to do with the positive people that I've placed in front of him. And so I'm really glad of that experience.
Great. Thank you so much. I'm glad that he's having a positive experience. It sounds like that was due in part to a strong family support. Let me turn now to Heather. I think we have Heather on the line.
I'm here.
Hi, Heather. Please go ahead and share your thoughts on vitiligo. Maybe if you could, maybe touch on the impacts vitiligo has on your daily life, maybe on the best days and the worst days. But if there's something specifically you'd like to speak to, we would be happy to hear that as well.
Okay. A brief history. My mother had full body change. She's Caucasian, but she went completely like albino white. Then she started to take an arthritic medicine, which is involved in some of those trials, and she started to repigment. And it was quite a challenge for her to live all that time, turning white, et cetera. But I was born with one white patch that eventually turned into what they call the lip and tip, the elbows, the hands, the face, the eyes, the knees, the vaginal area, the feet. And I've tried different medicines, nothing light related, but topical creams. One of them that burned actually my face pretty badly, that didn't work very well. But I'm in the entertainment industry, so I'm in front of the camera, and I've used a mineral-based makeup to conceal that some of the other people were speaking about. It's quite a process, and it does not stay on now that we've got COVID masks, et cetera. It's always rubbing off, and so when I have to deal with a makeup artist, I have to, don't touch it. It's going to come off. We're going to have a problem, and it's quite a challenge. Sunshine, very athletic. I'm also a dancer. I mean, so I can't go outside that much anymore. I just sort of have a restricted life. I've tried to get on some of the clinical trials, because I do believe, certainly from that experience with my mother, that there is something out there that may actually have benefit for people that are suffering, to realize some of their color return. But yes, all the points hit, the social sort of embarrassment, a little bit of fear about doing things with other people, swimming, just a lot of that stuff. Did I answer what you asked me to answer? Sort of go off.
Yes, no, that is fine. I think you gave us a little more context and really better understanding of kind of how it impacts your daily life. I mean, talking about the makeup and things like that. So yes, thank you very much. So let me turn now back to my panelists and discussion starters, and see if there's anything that you would like to add to what we've heard so far as the impacts of vitiligo, particularly maybe how vitiligo impacts your life on the best days, or on the worst days. And so maybe Andre, did you want to speak to this a little bit?
Yes.
Okay. If you could, there we go. Perfect.
Yeah. I definitely want to speak to this, because I think it's important that we recognize that, a lot of other autoimmune conditions who've had like spotlight on them, they say that people with lupus, they experience extreme emotional emotional states. And I also, just from my interaction with the vitiligo community, I see a lot of these things as well. I think definitely there should be focus on research that really pinpoints on the how emotional is connected to individuals with vitiligo, because from a lot of my conversations, and even from myself, from my own experience, I see that some of the things that go on in my day-to-day life has an even stronger emotional toll and tie to it, depending on what it is. And, as a therapist, I have to sit back and have a self-talk and be like, well, is this really worth getting this upset over, and different things like that. I know not everyone has those tools to be able to really look at these things, but I definitely think that there's a huge emotional tie, psychological and emotional effects that really affect people with vitiligo. And I think that's definitely something that maybe research should definitely focus on as well, not just on say medication or treatment or other alternatives, and everything, really getting a full depth and understanding of what individuals face on a daily basis while dealing with the emotional connections that, that may throw off our lives or, affect us in certain ways.
Great, thank you. I think that is also a very important point. So now let me turn back to the phones for a moment. I'm trying to kind of go back and forth. I think we have Katherine on the line. Katherine?
Yes, hello, can you hear me?
Yes, we can, thank you.
Excellent, thank you for having me, and thank you to the rest of the panelists. This has been really, really eye-opening. I'm a Caucasian woman that developed vitiligo in my mid-20s. I'm now 40, and the impact has been really the majority of my body in a very scattered, patchy way.
I'm also a professional woman that with a very outward-facing professional job where I cannot hide. And I don't want to reiterate what others have said about the impact on lifestyle and trying to stay out of the sun and how that impacts, my day-to-day routine. But I wanted to really talk about my desire to kind of blend and I think that this has led to blend my skin color, and that's really led to a lot of personal experimentation with this disease as it has progressed. We've all talked about the creams and the lasers and vitamins and everything, but it really brings up, I think, with doctors and people that I've spoken with about it, ethical consideration of wanting to blend and wanting to deal with the different colors that exist on your body and how that changes. So it's been a lot about acceptance for me, as others have already discussed. But I wanted to also just kind of mention and speak directly to the question that one of the regulators asked about treatment. Based on my level of acceptance with my body and how it's changed and how that's affected my life, I still would certainly be willing to take risk with possible therapies. I understand that regulators do a benefit risk assessment, actually in that industry, and but patients do too. And this disease really provides, I think, at least for me, a higher risk tolerance, even though I've gone through waves of acceptance with my body and my skin. So I think that we all are changing all the time, and stress certainly impacts that. But I'm excited about what the FDA is looking at here and taking patients' thoughts into account so that we can look at other options, not only to treat the disease, but also the underlying impact to behavior as well. Thank you so much.
Thank you for taking the time to call in. I'd like to take a moment now to turn to Dr. Chung. If you'd like to turn on your video, I know you have a question for maybe we'll start with our panelists, and then maybe we can turn to someone on the phone as well.
Thanks, Robin. So I remember Jackie mentioning, I don't think I heard a lot of other people talk about this before, that when she's, maybe sleeping at night, the affected and unaffected areas of her skin, I remember saying there's severe burning and itching. Doesn't seem to be related to the sun exposure. And I'm just wondering if any other people have experienced that as well. I'm curious, because I only remember Jackie talking about it. So yeah.
So Ula, do you want to speak to this? I see you have your hand up.
Yeah, sure. I can only say that just without being out in the sun and having some pain or that on my vitiligo spots, I have had it a few times, not many times, but then I've had it like maybe 4 or 5 times, but then it has been only on my spots on my hands, but not anywhere else on my body. But I've actually had it, but not very often. But when I've had it, it has been only on my hands.
The pain, and the itching and things like that.
Yeah, mainly itching, not necessarily pain, but more itch.
Great, thank you. So let me see. Mark, did you want to add to that at all?
I did briefly. I noticed that, I'm not sure if my camera's on, but I noticed that when my spots are spreading, they start to itch first, and it doesn't matter whether it's the summer, it doesn't matter whether it's winter, spring, fall. You feel that itch, you look, and it starts a new spread or a new spot is starting to form. I've never had any pain, but definitely the itching.
Great, thank you so much. So is there anyone else who'd like to add a comment about the itching or pain or anything like that before I turn to our meeting participants who are on the phone? Okay, so let me then turn to our meeting participants on the phone. Maybe we can go to Greg.
Hello.
Hi, Greg.
How you doing?
Hi, great, thanks. So we have you in the meeting, so if you could share any of your experiences in the next minute or two, we would very much appreciate that.
All right, thanks. Well, thanks everyone for doing this. This has been great. I can relate to so much that everyone has been talking about. But, the one thing that I wanted to share that I don't think anyone's really mentioned was, has to do with the social and emotional kind of piece. I'm almost 40 years old, and I was diagnosed with vitiligo when I was about 7. And, in my teens, I started to develop, substance abuse issues, and I definitely, looking back on it now, and all the work that I've done to overcome, my substance abuse issues, I definitely contributed to vitiligo, to kind of being, affecting that and being a part of that, being, feeling, insecure and a lot of anger and everything that, a lot of people have expressed, regarding vitiligo definitely caused me to abuse drugs and alcohol. And, it was just one thing, a number of things, contributed to my substance abuse, but I definitely would say vitiligo. So I really wanted to share that. Now, also, I'm 39 years old now. I've been sober and in recovery for 12 plus years. So I've overcome that, but, I've also, like a lot of other people have shared, I'm fairly comfortable with my vitiligo today. And I think, a lot has to do with it, but, 2 things. One is the work that I've done in recovery has helped me with dealing with my vitiligo. And also, psychotherapy. I've been in, psychotherapy for years, and that has, definitely helped a great deal. So the gentleman just spoke earlier about, the emotional piece and talking about that. And I think, I've been lucky to have, great therapists and people to support me in my vitiligo journey. The other thing, just really quick, I have a 20-month-old daughter, my first child, and, she started to develop some, patchy white spots on her skin. And, she was dealing with eczema, and my wife, she's a physician, and she was kind of just like putting it off, like I think it's just a side effect of the eczema, but I couldn't stop thinking about it, worrying, that she had vitiligo. And, I get very emotional, and so I just really wanted to express that. I'm lucky to be, we just went to a dermatologist, and I got confirmation that it's not vitiligo, and I told the dermatologist, that was worth the $25 copay, and I would have paid $500 to hear that from a dermatologist. But that just goes to show you, the effect of vitiligo. I worry, that my daughter might have it. And, so I just, once again, appreciate you guys doing this. And I really hope, positive things come from it. So thank you very much.
Thank you. Thank you so much for sharing that. And I think we touched earlier on kind of the unknown of vitiligo for yourself, but I can only imagine the challenges it has when it comes to the unknown for your kids and your other loved ones. Before we move on to other people on the phone, let me take this moment to turn to Shannon to share some of the comments that we've received online. And as a reminder, I think it's become clear to us that we're not going to be able to hear from every single person that we want to hear from today just by sheer numbers. And we do appreciate you calling in, but please know that anything that you share with us will be included in the report, even if we're not able to get to all of the comments online, and we will be opening that crowdsourcing site. But Shannon, please go ahead.
Thanks, Robin. Yes, as Robin mentioned, we're receiving many webcast comments, and we can't get to all of them, but they will all be included in the Voice of the Patient report. But we're receiving several comments about itching and skin sensitivity from more than 10 people. And one individual shared that their itching feels like tiny bee stings, and they never know when it will happen, and it goes on for about 30 minutes to an hour before it will ease. They've also shared that they have heat sensitivity, and they didn't realize that this could possibly be a side effect of vitiligo. They also shared that they have other autoimmune issues as well. We're also hearing a lot on the webcast about the emotional impacts of vitiligo, such as suicidal ideation, anxiety, depression, embarrassment, feeling ashamed, and people sharing that it's difficult to go out in the summertime. One individual shared that patients need more tools to address social stigma, personal anxiety, and loneliness. And especially for them, they grew up in rural towns where there's little understanding and underwhelming amounts of resources. And so they expressed the great need for these resources as well. Another commenter shared that they work as a registered nurse, and their vitiligo has increased significantly with the stress of caring for their COVID patients. And they cannot figure out what is triggering this immune response. They've increased their sensitivity to light, and they must wear polarized sunglasses as well. And they've experienced their skin burning very quickly in the sun, which affects their ability to do yard work, their ability to exercise and participate in outdoor activities. And they've stated it also increases their risk of secondary infections.
Great. Thanks so much, Shannon. I know that we've had over 100 comments so far coming in, and so you're doing an amazing job of kind of keeping track of those and sharing them with us. So I really very much appreciate that. So now I'm going to go back briefly to our people on the phone, and not to be confused with the Alicia on our panel, I'm going to go to Alicia on the phone.
Hi, this is Alicia Archibald. Can you hear me?
Yes, I can.
Hi.
Hi.
Hello. First of all, thank you to everyone on the panel. This has been great. I'm friends with all of your panelists except for the last one, Jackie. My vitiligo started almost 7 years ago. When mine started, I started with just a little small spot on the front of my head, and I was getting ready for work one morning. And let me preface this by saying only one person in my family that we knew of had vitiligo, and that was my grandmother, my dad's mom. Okay, so when I saw my first spot, it was just a little small spot on my forehead, and so I'm trying to get ready for work, and I thought maybe I burned my face with my curling iron, so I just kind of rubbed it with my finger, like, trying to flick it away. And I rubbed it again, and it was about the size of a dime. And instantly I knew what it was. I just said, oh my God, I know what this is. And so it freaked me out. It scared me. And so I watched it for a few days. And it was amazing to me because I had not noticed it. And it seemed like it just appeared overnight for it to be that size. So in my mind, I'm wondering, well, why didn't it start out smaller, or why hadn't I noticed this? And so, again, that was 7 years ago. Well, for like 3 years past that, I just kept watching it. I saw other small spots starting to develop on my face. That was where I saw it for about 3 years. And I started to get what they call the butterfly effect, what a lot of vitiligo patients have. Same thing with people with lupus. So there were a lot of questions. I didn't know a lot of people who had it. I had just gone through a really stressful time in my life the year before. I didn't think I was stressed at the time, but when they took my call, they asked me what did I want to discuss, and I said, well, gosh, there's so many things. Everything that the panel has discussed, I've experienced it. So it's an array of emotions, but what I told them I wanted to discuss was just the mental effect. I've accepted vitiligo, but what I've found, even in my own vitiligo community, sometimes when you say you've accepted it, still some people are like, well, I love mine. I'm rocking mine. And I love mine too, and I've accepted it. But there are times, and I appreciate Andre. I've met Andre and I've spoken with Andre several times. But there are times, like you said, when I go past the mirror, and I'm going to try not to cry. But there are times when I go past the mirror and, there are times when it does affect you psychologically. And I just had that experience last week. When I accepted it and decided I'm going to live with this, I'm not going to wear makeup trying to hide it anymore. That was back in 2019. I was getting ready for a party and I was putting makeup on. I've never been a person to wear a lot of makeup, and I've always been pretty confident, had self-confidence. But 2 weekends in a row, I was getting ready for a party, and I was putting all this makeup on around my eyes, trying to cover it up. But I made that decision at the end of 2019 that I was going to accept it. If this is what God has for me, this is how it's going to be. And it was almost like when I accepted it, that's when I really started to lose my pigment. Well, now at this point, pretty much the whole top half of my body has lost pigment. I'm losing pigment on my knees, my legs, my feet. So it is generalized. It's all over my entire body. I've had people, I'm a professional person. I work, when it really started, when I started to lose color, I was working at a bank as a banker. So I had people in front of me all day long, every day. So I've had people, I had a woman sit in front of me, and sometimes it's hard for them to focus on what we're talking about because they're looking at you and looking at your hand when you're saying, okay, you're pointing at a document saying sign here. So I had a lady walk out of my office, and then she returned back the next day, and she just propped her arm up at my office door and asked me, so I've been meaning to ask you, did you have some kind of chemical peel? I mean, what happened to your face? At that point when she asked me that, I was pretty confident, and that comment didn't bother me then. But it's comments like that. I had a little girl ask me in my office, why is your face so dirty? So it's so many different things. So it does affect you psychologically. So even though I've accepted it, and then I started my group because I started a group here in Athens, Georgia, simply because my grandmother, she lived with it, but she suffered with it.
Yes.
And
thank you so much, Alicia. I'm so sorry to cut you off, but unfortunately, we have a lot of people that we need to hear from today. But your experiences are really valuable, and it's very helpful for us to understand kind of everything that you've gone through. So I hope that you will consider kind of participating also in the crowdsourcing or sharing your experiences through the Federal Register, because it's really important for us to hear this. So let me turn back to the phone and see if we have Rochelle on the line.
Yes.
Rochelle?
Hello? Yes.
Finally, success, right? Sorry for all of the phone glitches. Please go ahead and
I just wanted to say that I'm 56 and I've had vitiligo since I was 25, and just like what Alicia was saying in Georgia, pretty much the same kind of stories that everyone else has gone through. But just recently, we had a flood and everything happened in our house, and we just had to have a restoration team come in, and these two guys came in and they were, looking at the house and everything. So my husband was showing them the carpet and so forth, and then I came in and they were asking us to sign something. I said, well, I can't sign it. Let me call the insurance company. So my husband went back out there and was talking to one of the guys who was just playing with our dog, and the other guy was gone. And so he said, well, hey, man, where's your partner? He said, oh, he's outside. He doesn't really feel comfortable with you being black and your wife is white. And all these years, I thought I had it pretty much together. I do a support group here in Virginia, and I talk to other people, and I'm, pretty comfortable in that. But for that moment, it's like, I'm not. I mean, but the guy started justifying. He said, I think there are a lot of fine black people in the world. So it's like a different kind of racism. And it was just really upsetting. And I couldn't believe, I said, after all these years, that hurt my feelings. Because that's, he didn't want to come in our house because that's what it was. So it's things like that I've been dealing with, and like what other people are saying with the kids. And I have 2 sons, and when they were younger, and that's what people would say, is that your son? Yes. Is him right there? Yes. The one in the red shirt? Yes. I said, the one with the brown face? Yes, that's my son. And, you're trying not to be, so frustrated. So I kind of try to find a little humor in some things to try to help me cope, not to cover, but just to cope. And it seems to kind of lighten the mood when you could talk to people about it. But I did try that PUVA treatment years ago, and it worked for me. And I had like 75% of my body was depigmented. And then it all came back with the PUVA treatment. But then I ran into a problem with my insurance company. And the insurance wouldn't cover it because the coating looked like it was for psoriasis. And when they found out I was taking the treatment, then that's when it all messed up. Then I lost it all again. So it's a struggle to go through that. It's hard on your body. And I don't know if I would do that again. But I just wanted to share that with you.
Yeah, thank you. Thank you very much for that. I'd like to turn now to one of our panelists, Alicia. I will tell you, all of you who are watching online, that your stories and that we're hearing today are really impactful and really profound. And I think that Alicia just wants to briefly kind of touch on the existence of support groups and things like that. So let me turn to her for just a brief moment. Go ahead, Alicia.
Hi, everybody again. I just wanted to mention the amazing support community our vitiligo community has. And this is something that has been slowly in existence for the last decade or so, and really has taken a huge push in the last 5 to 6, 7, 8 years. And it really has brought our community together and has brought us here today to the FDA. And that was through the support that we have for each other. And so any of you guys that are watching this that are on the panel that are looking for support, there are so many great places to go to. So just check Facebook, check Google, and check out support communities, and we will reach out to you and bring you guys together. There's great resources for kids now that I never had growing up, and great resources for parents and people struggling day to day with vitiligo. So you are not alone in this. We are here for you. Please reach out, and thank you to the FDA for doing this too, to bring us all together.
Thanks, Alicia. And kind of when you're mentioning of kids, I kind of wanted to maybe take a moment and circle back a little bit to Dr. Marcus's question, which was really trying to understand, as people are, particularly when you're younger, and not that it's different as we age, but when you're younger, and kids can be a little bit more harsh, I think, than adults sometimes. And so I think that what it would be helpful for us to understand is, would you be willing, would your younger self, I guess, for lack of a better term, be willing to kind of take a different amount of risk for an effective treatment than somebody who's been living with vitiligo for a longer period of time and kind of come to a degree of acceptance with it? So let me see if there's anybody who has any thoughts on that before we turn back to people on the phone. Is there anybody that might want to speak to that? And of course, as everybody is aware, we will be kind of getting more into that impacts of treatment in panel 2 this afternoon after what I will call lunch. Depending on where you are, it might be something different. Go ahead, Alicia.
Yeah, so I think, and I was telling Dr. Marcus this too, I think with the risks of being a child, what was hard for me when we looked into doing treatments was the frequency that we would have to do them in the doctor's office. So light therapy is something that is seen as probably the most effective treatment along with creams. And we had to go to the doctor's office 3 times a week to do that. And not having it in town, the cost associated with it, and the time spent, I think is what a lot of people just don't do. So as children, when you're running around, you're in all these activities, who has time for that? So I think if it's something that we can have at home, that we can do ourselves, yes, there are always risks in any kind of treatment you do. And so knowing those risks and being able to accept those risks if you're going to see results, I think a lot of people would be willing to do that. But I think for most of us in the vitiligo community, having it not take so much time and so much money is key.
Thanks. Let me go to Mark now.
Yes, I just wanted to add quickly that when we look at our youth and our students, I think a big component is education. We have to not just teach our children how to accept kids with differences or adults with differences. We have to teach our adults as well. And I think the big difference between our generation and the kids' generation, I feel like our kids are more about inclusion. They support each other. They like to include. But I think in our generation, anyone who looked different, whether it's a condition, skin, whatever, we kind of balked at that. We kind of, that's standoffish, or we treated them differently, as others have put it, like monsters sometimes, based on how you look. But I think our youth are at a point where they are more understanding than we think so, and we need to give them credit. They do understand, and also they can sometimes teach us as adults how to treat each other. And I think a lot of it starts with our elementary school kids. Teach them there how to accept, our conditions and other conditions. And as they become adults, I think they'll have less issues. But also, let's look for ways to provide treatment to our youth, for our kids that need it or that want it. And I think a lot of times the want comes from the parents, because they want the kids to move about normal like everyone else, as what we consider normal.
Thank you. Yeah, thank you. Let me turn briefly to Sharon, and then we're going to go back to the phone lines. So Sharon.
So thank you. I absolutely think that if there were more options and there was more information in 1999, I would more likely than not explored other ways to treat my vitiligo. But at the time, I just made the basketball team. As Alicia said, we were doing all these activities. And my mother was a big advocate when I said I didn't want to do it. That was just it, and I think that sometimes, like Mark said, parents do get caught up in that and not wanting their children to be ostracized and things like that. So I absolutely think if there were better options, more options, options that weren't just medical, I definitely would have engaged more in some type of treatment or some type of support. As Alicia said, there wasn't a lot of information back in those days, where you see now everything is inclusive. You see vitiligo everywhere in the mainstream, everywhere. So it's not, you don't feel as alone as you would have, back in our day. I like to. So yeah, that's what I got to say.
No, thank you. That's helpful, and I think we have made some progress. So I think that is really very encouraging. So let me turn now back to the phones, and I think we have Kathy on the phone. Hello. 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 Okay, so maybe we'll put Kathy back on hold for a moment and go to Michaela.
Hello, this is Michaela from Iowa.
Hi. If you could share your experiences with us in just a minute or two, that would be, or for just a minute or two, we would really appreciate that.
Sure. I am 35 years old. I have had vitiligo since I was 2. I have universal vitiligo, so I'm completely depigmented. I just wanted to say that once you have universal vitiligo, I feel like a lot of dermatologists think that you're fine. And I would like to say that it's not over when you're completely depigmented. Like, you still have the effects from, for me, childhood, the emotional effects. And then also, I worry about my children. I have a son who has vitiligo, and thinking about having more children really worries me. because I already have one that has vitiligo. And there really aren't that many treatments for my son. The ones that he's doing right now are the laser treatments, and he has to go 3 times a week. And he doesn't like having to do that 3 times a week as an 11-year-old. So treatments that we could do at home would be awesome, and more options would also be great. And then also the depigmentation of hair is a big thing for me, having universal vitiligo. If there were any treatment options for that, that would be wonderful.
Great, thank you. Let me turn now to Terry on the line. Terry?
Hello?
Yes?
Hello? Is
Hi.
this me? I'm Terry, actually, if that's who you're
yes, that's who I'm looking for. If you could share your experiences in just a minute.
Terry from Philly. The main thing I want to say is it's important for vitiligo sufferers to find the right dermatologist, because I didn't at first. Very briefly background, in my 40s, I had a very small spot. Once I got over 60, it exploded. And it exploded literally overnight. One morning I woke up, my forehead was gone. One morning I woke up, I had spots all over my arms. So I went to the dermatologist that I had used for years for relative, assorted matters. She treated me with creams and never mentioned that there was such a thing as UVB treatment. Never mentioned it. For 2 or 3 years, I was just treated with the creams. And one day she said, well, you probably will be a candidate for having all the pigment removed from your skin because, it's pretty pervasive and, that you haven't responded to the creams. Well, I knew I didn't want to do that. So I checked, I looked things up on the internet, which unfortunately I'd never done before, found a dermatologist that had UVB treatment. So I went in there, and within 5 minutes, she said, why haven't you been getting UVB treatment? And I said, it's never been offered. So I began to have that, and it's no panacea, but it does provide very gradual results. It does shrink, in my case, does shrink some of the spots. But I went to and this was no hole-in-the-wall dermatologist. This was a respected mainline Philadelphia dermatologist who withheld knowledge of a certain type of treatment either because she didn't know about it or couldn't do it. So yes. I just want to stress the point that it's important to, if you're not happy with your dermatologist, look further, because I never would have thought to have had that. God forbid I have cancer, and she withheld treatments. So very important, and I want to make sure that all your listeners know that. Don't settle for somebody who doesn't know what they're doing.
Right. I think it's universally important to find a care provider that that you're comfortable with. Thank you for that. Let's go to our. I know we're going to be wrapping up the session. In fact, we're a few minutes over. Let me get one more person from on the line before before we wrap up this session. I believe, would that be Terry? Okay, maybe let's go to hello.
Can you hear me?
Yes, I can hear you. Please go ahead. I would ask you just to keep your comments relatively short, because we've kind of run over in the session, but we do want to hear what you have to say. So please go ahead.
Okay, my name is Terry. I'm calling from Atlanta, Georgia. I'm going to keep this very brief. This is about the FDA and vitiligo. Okay, basically, FDA knows a lot of information in reference to diseases and everything else. The reality here is that the FDA just needs to pay attention to vitiligo. We know at this point in time there is no really known cure for vitiligo, and I've heard the whole calls all morning. I've heard the calls and the concerns of people. There's only one reality, is that the FDA is going to cooperate with vitiligo community in reference to treatment or other things that we need. And it's really just that simple. So FDA, the topic of discussion today is working with the patients. We need your support in every area of treatment at this point. And it's just really that simple. FDA you have enough resources to study vitiligo, and at this point, there is no cure. Research and money will help the situation at this point, and it's really just that simple.
Hey, thanks so much, Terry. Appreciate your comments. So now at this point in the meeting, I'd like to invite all of our panelists and discussion starters to just turn on their cameras for a brief moment, just so that we can really say thank you to everybody for the really important and important and insightful and really impactful comments and thoughts that they've shared throughout our first session. I can't tell you how much we very much appreciate all of you sharing this information, and I really hope that this will really make others understand what people living with vitiligo are experiencing. I also want to take this opportunity to thank people who have submitted comments and called in. We're going to take, so thank you all. Really appreciate it. And we're going to now take a break until